Welcome to QD Clinic. Hi, I'm Jack Cush with RheumNow. QD Clinic is brought to you by RheumNow.live. Great speakers for great rheumatologists like you. Today's case is the unmet need in gout. Just think about it. You should be able to write me a list of 5 things right off the top of your head about the unmet need in gout. And if you can't, well, then you need to work on your gout. So this case is 55-year-old man who, let's just make it a woman, postmenopausal woman, right? This actually was a man. 9 years of gout. The patient is still not on urate-lowering therapy, in spite you're instructing him or her to be on urate-lowering therapy. They've got a lot of excuses. It hampers their lifestyle. They don't want to be tied to blood tests and coming to see you, meaning that you're running their disease. They want to run their disease, and they've declared they're horrible at running their disease. And the status quo is that the patient wants to manage their disease on their own. They want to wait until the blank hits the fan, and they have to come screaming to you because of all their pain. They want to manage their pain and their flares with PRN colchicine, which I don't use in anyone anymore, only under duress and under select situations. Or they want a hefty pile of steroids that they can pop at will when they get a twinge in their joint, which is they believe to be an impending gout attack, and there's no way of knowing whether it's true or not. And of course, they don't want to alter their lifestyle in such a way that would actually prevent attacks. Stop alcohol, lose weight, control comorbidities, get rid of the provocateurs of gout attacks. So again, gout is a challenge for all of us. Too many of us think we're expert in managing gout when in fact we're not. And the data on the number of gout patients that you manage that are taking urate-lowering therapy is still really low. It's often less than 50%. In primary care, it may only be 20-25%. Of the patients you manage with gout, the number who actually achieve target, you would say, well, I have them on urate-lowering therapy, I monitor them, and they achieve target, most of the time, and the data shows no. It's like 40% at best, maybe 45% if you're a rheumatologist. And if you're not a rheumatologist, primary care, again, it's like 30% or less can achieve target. And I think that this is a gigantic unmet need in society. I mean, there's 1.3 million people with RA. There's 10 million people with gout in the United States. For this reason, I've asked one of our speakers at RheumNow.live to address, what's ahead, what we should be focusing on, what the unmet need is in gout. And that's Professor Lisa Stamp from the University of Otago in New Zealand. If you follow Dr. Stamp's work, she is prolific in her writings and research on gout. She has written a lot on gout management and gout assessment, and she's going to address the things that you need to know in managing those patients who are not optimally managed with gout, which fortunately I think is the majority of my gout patients. We have to get better at this. Tune in for more QD Clinics.